And today we are restarting the schedule of our yellow webinar after the summer interruption. And it's a great pleasure to start this new leg of the program with one of my best fellows, which is Francesco Negro. Francesco is professor of medicine and hepatology and pathology and immunology at the University Hospital of Faculty of Medicine, University of Geneva, Switzerland. He started his career in Torino, then he immigrated in the United States to spend some of his time at NIH, and then returned to Europe, where he got the position at Geneva University. Francesco devoted his career to the several lines of interaction and research in hepatology, and is now treasurer of the European Association for the Study of the Liver, after having served on the board for more than 4 years, if I remember correctly, and is hyper busy due to the several commitments. We were discussing before starting the meeting of the future of our life, and this is within the frame of this title today, which is "What is the Future of Hepatology?" It's a very catching and exciting title. I'm sure that Francesco will give us an outstanding presentation, and I leave the podium, the virtual podium, to Francesco. Please, Francesco, go ahead, and we'll enjoy your presentation. As usual, the discussion will follow your presentation. Thank you.
Thank you, Claudio, for this very flattering, nice introduction. I'm very pleased to discuss with you, dear colleagues, today a topic which is quite a challenge, as you rightly said, because it's been the topic of many discussions, debates. What's going to happen to our fellows, current fellows? What are we going to tell people who want to become hepatologists now in 2021? As I said, Claudio, I've been giving this talk several times, and I'm very happy to share it with you today, some of these topics. Let me share the screen. I hope you can see it. Can you just confirm that is?
Yes, we can see it clearly. I mean, it's too large. You have to reduce the size because we see just half of the slide.
I don't know how to change this.
Try the second one and we'll see. Try the second one.
How's that?
Yes, that's good.
It's good? Okay. So as I was telling you, Claudio, before this presentation, I gave this lecture the first time in 2016 when Laurent Castéra was then Secretary General of ISOL, invited me for a master class, and I said, okay, I can accept this challenge. But the first thing I did was to go to the literature to see what had been written about this topic by predecessors. And I found a very interesting an article by Hans Popper. So Hans Popper, for those who know hepatology and know pathology for many years, like myself and Claudio, he was one of the founders of modern hepatology, a distinguished pathologist who received a Distinguished Service Award in 1983 at the ASLD meeting in those days was in Chicago. It was presented by Irene Rice. And he gave a lecture about the future of hepatology, and of course he wrote an article about this. So I went to read the article, and basically what Hans Popper says is that liver diseases, in his view, are the sum of environmental factors and host modulators, which includes, of course, on the one hand, viruses, alcohol, chemicals, on the other hand, soluble factors, pericellular structure. It was a pathologist who was insisting on this aspect, and the whole thing modulated by genes. This was the view of the future of hepatology, certainly very true. Absolutely, I'm certainly not here to question what Hans Popper said. But if you fast forward to hepatology today, since 1983, I have to admit, hepatology has been changing dramatically, also and especially because, first of all, the lifestyle evolution. It is a societal problem which led to the explosion of a metabolic syndrome. And we had the advent of internet, which has certainly changed everything, all our lives. The coming of age of liver transplantation, high throughput drug screening, many other things. What I'm trying to say with that is that none of these advances could be predicted in 1983. Nonetheless, they did change our discipline. And it's even more important than that is none of these changes came from the field of hepatology. So now if you ask me today what's going to happen in the future, I should probably look outside of the box and see what's going to happen in the next few years. Predict the future is certainly, I mean, a huge challenge, can be spot on. Can you imagine the left-hand side picture was drawn in 1930? And it's quite spot on because it shows two people sitting and drinking at the same table at the bar. They don't talk to each other. So they predict very nicely this social aspect. I mean, and actually they're phoning someone else and they are video conference with someone else, irrespective of what the other think, each other think about. And there is a very obscure newspaper on the right-hand side from Midwest, United States, in 1963, predicting that you will be able to carry a phone in the pocket in the future. So these actually two predictions were right, but sometimes can also be very wrong. And I like a lot cinema. I'm a cinema fan, those who know me well. And I always make the example of Blade Runner, which is a cult movie, was directed by Ridley Scott, as you know, in 1982. And he was imagining Los Angeles in 2019. I mean, not only is not raining 24 hours a day in Los Angeles today, but as far as technology is concerned, look on the right-hand side, you see Rutger Hauer, who is actually one of those famous replicants that Harrison Ford has to kill, terminate. And he has to go get into contact with one of his colleagues, a replicant, and to do so, Los Angeles 2019 is using a payphone. Can you imagine? I mean, to predict the future technological is extremely risky. We don't even know what's going to happen 20 years from now. So science, it is actually, a nice sentence that was quoted by Scott Friedman. Scott Friedman wrote an article about the future of hepatology in 2015, not a long time ago. Science has not mastered the prophecy. They are not a prophet either. In fact, we predict too much for the next year and far too little for the next 10 years. It was said by Neil Armstrong, the astronaut, and the famous astronaut. It's quoted by Scott Friedman, another famous hepatologist. So I would like to turn the question, not what is the future of hepatology? It's very difficult to answer because I don't have the gift of prophecy, but what would I tell my child in case he or she wants to become a hepatologist today, 2021? Okay, let's see. So there is a very easy answer, a frequent answer is this picture, which was borrowed by Stefano Bellentani. I know if he's online. He wanted to get online, I don't know, but I want to credit the fact that Stefano shared this slide with me. It's very frequently used by hepatologists to predict what's going to be the profile of an average liver patient in the future. We can agree or not. Certainly, metabolic syndrome is going to play a major role, and hepatitis C may disappear, and so on. There is also another frequently answered slide, which is the progressive phagocytosis, I think, by other specialists of liver disorders, like viral hepatitis taken over completely by infectious disease specialists, steatohepatitis managed by diabetology, and so on, alcohol by addiction specialists, liver cancer by oncologists, you know the story, end-stage liver disease by intensive care specialists, and liver transplant only by surgeons. And the question would be, can hepatologists survive managing leftovers like cholestatic and genetic disorders? I don't know. I think this is probably not true, because I believe hepatology will keep being directing, especially multidisciplinary teams of many specialists surrounding liver disorder, but I will not delve into that too much. So I will going to share with you some random ideas about research, teaching, and healthcare as far as liver disorders are concerned. Let's start with research. There are so many stereotypes about science, scientific research, and so on. And one of these stereotypes, very commonly stereotype, is that we have to deal very often. I have to deal because I'm chairing the MD PhD committee at the University of Geneva. So I have to deal with many students of medicine who want to become researchers. And they have a very romantic idea about science, which a little bit corresponds to high school science. It means take courses and getting the right answers, tests, and about questions, general questions about science. This is actually not research, of course. Research is something very different, is immersion to the unknown, like this article on the left-hand side describes very, very well. It means to be confronted with our own ignorance. So it is a kind of a huge challenge. Curiosity clearly is the most important quality of a scientist, but they have to be confronted with our own ignorance. And there is a famous lecture, I would like you to listen, if you have time, or one of these magnificent TED Talks, which are free, by the way, open access, by a neuroscientist, Stuart Firestein, The Pursuit of Ignorance. The more you know, the more you realize how much you don't know. And this is true also for science, of course. And so if you want to be a scientist, you have to be confronted with this challenge. The other very frequent stereotype about scientists is that we believe that this challenge is taken alone. I mean, the scientist is very often being seen as a loner. And this was probably maintained by the fact that many, in the very beginning, scientific articles were signed by single scientists. Like this, for example, is the epidemic of jaundice in Bremen in 1885. But you know, this stereotype is maintained, especially by the literature, by the cinema, of course. And I can tell you, really, please don't forget about it. Scientists do not work alone. They've never been working alone in the past. They don't work alone now, and will never work alone. They always work with a team and supported by not only those who came before, but also those who work together with them. This idea was gradually taken over by scientists, not with some bit of arrogance, let me allow to say this. You know, remember very well the episode of The Time of the Duels, like Watson and Crick, but where is Rosalind Franklin, for example? She was never acknowledged until recently what her contribution, fundamental contribution, was to the discovery of DNA structure. I mean, timidly, collaborators were started to be acknowledged with the time, and today it's absolutely impossible to publish a very important paper without mentioning the input of many collaborators from many different teams who are actually working all together. So why am I saying this? Because I think there is, first of all, you must understand you're not working alone. You're working starting from a certain point. You have to acknowledge the huge contribution which has been provided by our predecessor. Let me mention this very famous letter by Isaac Newton to his rival. There was some irony in this, Robert Hooke, 1675. I've seen it a little further. If I made some discoveries, it is because I'm standing on the shoulders of giants, which means I've been profiting what the knowledge has been contributed to by many people until now. And there is also very nice and deep work by Umberto Eco, by late Umberto Eco, sulle spalle dei giganti. I encourage you to read it, because we have to humble enough to recognize we do not start from zero alone in our scientific lab. Of course, teamwork means to address two major questions: accountability and reward. And of course, we don't have the time to go into depth with this, but it's very important to recognize that we do need to work in teams. And not only because it's important to acknowledge and reward our collaborators, but also because there is scientific added value in working in teams. There are a lot of sociological works showing that. There is a very interesting sociological experiment published by Williams Woolley in Science 11 years ago, talking about the so-called collective intelligence factor, the F factor. Collective intelligence means that you're working in a team, and the result is not just the sum of a contribution of each participant. And the performance of a group is certainly positively influenced by the fact that everybody is free to express themselves, and equally express themselves. Interesting fact, when a higher proportion of women participates to the team, and last but not least, when there is a high average social sensitivity. And this is the last point I want to make about research, is that, and the COVID crisis has shown that very nicely, do not forget, even as a scientist, a huge social mission to accomplish. You have to provide responsibly the best information possible as the basis for public policy. And you have examples in 1 year of COVID crisis how these missions are not being perfectly accomplished by many of our colleagues and scientists, unfortunately. So if I had a child who wants to become a scientist, of course, I would tell him and her, your qualities must be, first of all, curiosity, to be ready to challenge, to confront our ignorance, patience, courage, detail orientation, creativity, persistence, communication skills, we come back on this, critical thinking, we discuss this later on, open mind, but especially, I think, two more factors are extremely important to make a scientist a good scientist: humility and awareness of our social role of science. Please don't forget these two aspects. We come back on this point. Let's talk about teaching. Teaching is very dear to me as a topic. I was invited by Laurent Casterat to be part of the governing board of ISO in 2015 as an educational counselor. And I was kind of perplexed to see how the schools were in those days organized. The schools were organized in this way. It was a lecture and discussion, second lecture, discussion, third lecture, discussion. I mean, discussion were always very short because people were always talking. And at the very end, there was a state-of-the-art lecture, which is, for me, is really the cherry on the cake, because we have 1,000 of people or hundreds of people in the same room collected together. They listen to an expert. Wonderful, absolutely. I don't want to, diminish the importance of these talks. But why do collect people in the same room to listen to a lecture which can be actually easily listened to online, like now, for example, and state-of-the-art lecture, by definition, have no discussion. So this, for me, was absolutely intolerable for a school. Teaching in traditional classroom was when teacher-centered. There was this figure of the people talking ex cathedra, content-oriented, and in general, students were passive beneficiaries of the learning process. So this Eric Mazur was a professor of physics at Harvard. Once he made a poll in his students and his residents, and he asked, what are you good at and how did you become good at it? The questions, the answer were reading textbooks, surfing internet, listening to lectures given by experts, state of the art, doing things by myself, and doing things under the guidance of an expert. So guess what was the answer? Of course, doing things under the guidance of an expert is the most important way to learn something you're good at. So we insist on lectures. Why do we keep teaching this way if you don't learn this way? That was the conclusion of Eric Mazur. Actually, was the first to introduce the concept of flipped classroom. I will discuss this in a moment. It's very important to keep in mind how do we retain learning, because there is one additional level of learning, method. The worst clearly is listening to a lecture. And this, I'm saying this against my interest of now, because I believe that in 1 week, probably you will forget about 90% of what I'm saying. It's typical. There's a better ways to participate, to exercise yourself, discussing with people and for co-experts. Even better is to practice under a guidance of a coach. Or the best way to learn something is to be a teacher. This is why I'm always very happy to accept to give a talk, because that's how I learn things, in fact. It's a very important design. Don't forget this aspect. It's very important. The second point I want to make is the information today is everywhere. With internet, you can access pretty good quality information almost everywhere. Of course, there is a lot of fake news, biased, incomplete, selective, but it is very rich to unprecedented levels. And actually reminds me, internet today was one of my dreams when I was a child, a teenager, the so-called Library of Babel. Those of you who know Borges, of course, know what I'm talking about, right? This infinite series of books writing and describing everything can be conceived. The problem with information is not education. The imparting information is not to educate people. Information deals with literacy, so knowledge, dates, notions, all that stuff. But education is the functional literacy. And functional literacy is not based on intuition. So there is a book written by Daniel Kahneman, who is Nobel Prize in Economics a few years ago, which is a wonderful book. I really recommend that to you. Showing how we reason in two ways. There is a system one, which is fast, using shortcuts, so-called heuristics, and we reach decision very quickly when we need them, but is also burdened with cognitive biases. And then there is a system two, which is rational critical thinking. Of course, it takes time. Of course, you have to know data, reason, discuss, and all that stuff. It takes a lot of time. You cannot use system two all the time. Otherwise, we will not be able to decide what to do in our daily life. But it's very important to be aware the system one is affected by cognitive biases. So there is hundreds of cognitive biases, very classified. You see here just one image showing how diverse they are. Is very important. Some are very famous, in fact. And it's very important to know in this landmark paper by Tversky and Kahneman in Science, that we all have to make fast judgments under uncertainty. It's compulsory. It's an obligatory way to deal with the everyday's life. And to do so, we must be aware of the fact that we use mental shortcuts. We call them heuristics, availability bias, and adjustment for an anchor, and so on. These heuristics are certainly very economical, effective. but they lead to systematic and predictable errors. And that's very important in everyday life. You must be aware of this. Some of these biases are very well known. Availability heuristics. I mean, we think that the first thing that comes to our mind when we rely on immediate examples, I mean, are the appropriate one, which is wrong. Most of the times this is wrong. Dunning-Kruger is very famous effect. We don't need to discuss this. Authority bias, for example, if a Nobel Prize claims that papaya is good to cure Alzheimer, must be true because it's a Nobel Prize award. So I mean, essentially, that's what I mean by biases, okay? And since one of the frequent questions about this talk is social networks, I mean, social networks is a very good example how cognitive biases affect our daily behavior. People look for answers in social networks, internet, blah, blah, blah. There's a major confirmation bias directing their partners to groups, dealing with other people, and they lead to the formation of echo chambers, and this polarizes the scientific discourse. It's true also for political discourse, many other things, but this is quite dramatic, and you have dramatic examples in the COVID debate today, vaccine and so on. Essentially, people will agree with you only if they already agree with you. That's a confirmation bias. Very ironically stated by Frank Zappa. He was kind of a genius of music, as you all know. So before I deal with this, I want to say something else. Artificial intelligence. Okay, I mean, artificial intelligence is actually perceived as a threat because I mean, the people may actually one day have to fight not to become useless. I mean, because they fear they be replaced by artificial intelligence. It's only partially true because, I mean, again, artificial intelligence deals with the information, it's not the education. It's very difficult that we can replace our behavior completely by artificial intelligence. But nonetheless, fear is there. Just an example, a Guardian article appeared a few months ago, was completely written and was very logically written by a computer. But he also said, somewhere in the text, I am only a set of code. So you need a coder anyway to do this kind of work. I strongly believe that soft skills will not be replaced soon by robots. And soft skills, we have to insist on these soft skills at school. I don't think we'll be replaced soon by robots, or maybe they will, who knows, aliens can actually replace us so for many reasons. You see, Blade Runner, also The Return, someone who has seen this movie recently. Why we must focus on 21st century soft skills? Because these are very important to our profession. One is critical thinking. Recognize and avoid cognitive biases, Cunningham systems too. Collaboration, to use emotional intelligence. We already know what empathy is, empathetic behavior with patients, but it has to be also dealt with colleagues and with the lay people who don't know our background. We must learn how to negotiate within teams to reach a shared decision. We have to learn how to communicate, and we be service-oriented. These are very important soft skills we must insist. Can we use problem solving to learn soft skills? Yes, we can. Actually, this is actually very important because we like problem solving. We do a lot of problem solving, which is completely useless. Everybody does crossword puzzles. We like solving problems because this conveys pleasure. It's a reward system. And we can add also the collaborative dimension to problem solving. It's actually being insisted by OECD in the PISA evaluation of students. There are many reasons, foster acceptance of effective division labor, and blah, blah. You see all these reasons here, which are very important to justify the teamwork. So the EasoFit classroom model, which has been introduced in 2016, the first was here in Geneva, is learner-centered. It's not teacher-centered, learner-centered. It's problem-oriented to stimulate interest in knowledge. Why do we need to know some data? And students are actively elaborating a solution to an assigned problem within a small team under the guidance of a tutor. So the difference with the traditional classroom is this. In a traditional classroom, the teacher is a sage on a stage. Students listen to lecture, take notes, are assigned homework, do homework at home, alone, and have exam to pass. In the flipped model, students are assigned pre-reading guidelines, for example. They get familiar with their contents. They do classwork. They gather people in a classroom to work together. That's the reason why you put and you move people from miles away to be all together in a classroom. They apply the learning content to solve the problem while developing all the soft skills they need: critical thinking, collaboration, service orientation. They do it exclusively within a team. And then they very important, become teachers. If they have task assignment in the School of Hepatology at ISO, they have to prepare a PowerPoint. So have to be ready to give a lecture the next day in front of experts. So they train also their communication skills. Let's talk about healthcare very quickly. I mean, because everybody knows that medicine is moving from acute to outcome-based and value and the population and continuum of care and predictive medicine. Everybody knows this, especially very nicely illustrated by the expansion of the metabolic syndrome, obesity. WHO is making efforts to contain this so-called pandemic. Diabetes expanding is going to be reaching dramatic prevalence in 25, probably even further than that. Oh, not only that, I mean, that we have to deal more and more with the elderly population. These are projections. When we reach 9 billion, everybody knows that we have to deal with an older population. Older means a polymorbid population with a number of different disorders at the same time to deal with. And this requires, shift from communicable to non-communicable disorder, teaching and management. Need us to know about the frailty of these patients. The pharmacokinetics has been altered, interaction between different medicines, affection with are iatrogenic, of course, and also the fact that absolutely this polymorbid patient will require more and more multidisciplinary team-based integrated management. There is no question this is going to be unavoidable. It's very simple to know. And the other point is, which is very important, is migration. And migration is expanding. From poor countries to rich countries. It's not only affecting Europe, it's affecting the United States, many rich countries. You cannot stop it, and you have to learn how to deal with it. Dealing with migrant healthcare has been also the focus of a position statement of European society. There are many aspects to be dealing with: legal restrictions, cultural, religious, language barriers, widespread distrust of Western approach to medicine. You have to deal with this, unfortunately. Sometimes the medical history is very difficult because of the language barrier, lack of data, and very diverse disease spectrum, genetically, infectious diseases we never seen before, parasitic disorders, and nutritional habits were very difficult. There is a policy statement on our website. Please go there and download it. You can read it, stop and access. But healthcare is not only healthcare. I think the most important aspect I want to discuss with you very quickly is not healthcare, but access to healthcare. This is more important than that, because everybody knows that hepatitis B vaccine has been a success story. According to this modelization of the imperial vaccinations, has averted more than 300 million new cases of chronic HBV between 1990 and 2010. So we know that. And there's also, I don't need to remind you that vaccines in general have been averted a lot of deaths, preventable deaths, preventing infectious disorders. There is a very recent modeling paper again by the Imperial College. Very important paper. But the question, however, is every child profiting from this success story? Well, infant vaccination, yes, is widespread. But however, only 96 member states of WHO have introduced the hepatitis B birth dose vaccine. And we must scale up this birth vaccine. Just think about, in Africa, for example, only 50% of deliveries are attended by skilled health staff. So this is a tragedy, because when the child is born, there is nobody there to deal with the mother and to deal with the child, to vaccinate the child. So this is a real problem that has been raised by WHO years ago. There are some actions being undertaken, but it's not really working. It's not working. Also, Big Gavi, for example, withdrew his support for this vaccination campaign, birth dose, because many reasons, but most important reason is that if I think, and I share this view, it's completely useless to help a vaccination birth campaign if you don't have the mother, first of all. And why I'm saying that? Because there are too many barriers to maternal health in these 4 countries. Because first of all, most of these births are out of facility. Skilled birth attendants are never there. There is a male domination maternal healthcare workforce, unwillingness to be examined by male care providers. There is if there's insufficient cultural sensitivity of many NGOs, very difficult to deal with these cultures. And also this tragic aspect of adolescent girls who are denied health. So these are the most important barriers to maternal health. And these are the most important reasons, not the lack of vaccines. Vaccines cost very little. It's the most important reason why HBV birth dose coverage in Africa is very low. just to think about, I mean, in Europe, we have 20 maternal deaths per 100,000 live births. In Africa, we have 480 maternal deaths per 100,000 live births. So every minute a woman dies, either in labor or suffers lifetime complication. By the time I finish my talk, 50 or 60 women will have died or have suffered lifetime complications from pregnancies and delivery. So if you don't deal with that, I mean, you cannot really deal with vaccine, of course. But there is a sense of priority we must be aware of. Okay. And the other point, which is actually quite flagrant about the access to care, is the cost of hepatitis C drugs. I mean, you know, when they came out, for example, Cameroon had to double the total health expenditure just to pay hepatitis C treatment. So for only one disease, it's absolutely crazy. Situation has changed a lot because Medicines Patent Pool is an NGO based here in Geneva dealing with the patent transfer. But still, if you look at the cascade of care of hepatitis C, these are data from the Polaris Observatory. In lower middle income and low income countries, absolutely a tragedy. I mean, too few people have been treated for hepatitis C. So now the question is whether technological advances may improve the access to care. I think it may actually. There are many examples. I mean, artificial intelligence, I mentioned that, machine learning, personalized medicine, Internet of Things, telehealth. And telehealth maybe, yes, because especially talking about telehealth, there is one way to, I mean, it's just proposing. I cannot talk about all these topics. We don't have the time. Let's talk about smartphones. This is 2005 in the Vatican, actually when John Paul II died, there was a funeral, okay? And you take the similar picture 8 years later at the inauguration of Pope Francesco, Papa Francesco, okay? That's the difference, you see. Today, I would say almost everybody has a smartphone. They can do a lot of things with smartphone because everybody has it. And the computing capacity is increasing very quickly. I mean, today we have everything on S20, for example, iPhone. You can do tests, for example, in the savannah, in the jungle. You can do, for example, infectious diseases at the point of care. You can do PCR, isothermal PCR. This was developed by Graham Cook at Imperial College. It can be done, of course. And you can do also ultrasound. You can still not do fibroscan. It will come, but it requires processing capacity, which is very high. But this probe can be actually connected to a smartphone, the Lumify by Philips. And Philips is developing a lot of also resources. For example, this so-called REACT platform. You see in the background is a mother, a pregnant in Ethiopia, and the lady who's actually guiding the mid-level health worker who's actually applying the ultrasound. She's based in Addis Ababa, in the capital, of course. I mean, you can actually do telemedicine very effectively with the technology. It can increase access to care. Also, if the patient cannot go to the hospital can go to the patient in remote villages, for example. And then I would like to, there's a couple of more slides. I mean, this actually, I'm insisting on this aspect because we have all been witness, and especially our generation, Claudio, because we started hepatology in the 80s. It was almost nothing, right? It was almost what we call contemplation hepatology. I mean, we're just shaking hands with many patients. We had no drugs at all. And if you look at what happened, I mean, in the space of one generation, we've been able to wipe away the hepatitis C, for example, with just very 3 months of medicines without side effects. Okay, this is very important. Technology has been fascinating, what has been contributing to the development of hepatology, but it's very important not to forget that we want everybody to profit from this. There's a wonderful book. Peter Pio was one of the chair and founders of UNAIDS, and is now a director of a London School of Hygiene and Tropical Medicine. He's done a huge amount of humanitarian work. He's actually was one of the witnesses of the first Ebola outbreak in Congo. He could contribute even to naming the virus Ebola, by the way. And in this book, a very fantastic book, is autobiography, is why ultimately chose medicine. Okay, too many desires. Travel, everybody likes to travel, even in COVID times, unfortunately, we had to stop, but also to work for greater social justice. Because he clearly said, you can read by yourself, medicine dovetailed with my childhood passion for science. A medical degree was a passport to work anywhere in the world. And ill health was surely the worst kind of injustice. So as a doctor, you can really be useful and very useful. So I want to conclude my lecture in this way. So if I had a child who wants to be a hepatologist of the future, be aware that first of all, the spectrum of liver diseases will change. Will be a huge focus on non-transmissible diseases, which means work harder on prevention. And also you have to be ready to deal with older, polymorbid, ethnically diverse populations. Migrants will not be stopped. I mean, this is ever-going phenomenon. You must be friendly with new technologies, artificial intelligence, Internet of Things, and all the sort of that. But even more important, you must learn softer skills. I think we don't insist enough in our schools of medicine. We must learn how to use emotional intelligence, communication skills, and service orientation. If you have professional changes, well, you can anticipate them, but be aware they will not come from hepatology. They will come from outside hepatology. And we don't know what they are, of course. But most importantly, I think you must ready to invest in access to care to make sure that everyone can benefit from the hepatology of the future. In this, I want to thank you very much for your attention, and I'm ready to take questions, if any.
Thank you very much. This has been a wonderful presentation. Can you remove the sharing of the screen?
Yes.
Okay.
Let's see, how can I do that?
And this has been a very important, a very thoughtful, and very inspiring presentation. And I open the discussion to anyone who wants to intervene. Please, don't be shy. Well, waiting for questions. I think following your presentation, I had two thoughts. Number one is that Hans Popper was really a visionary. The guy was running. I had at least 20 years of his time, and he actually he actually was able to foresee the future in a very efficient way. And second is that I agree, obviously, with all you mentioned, but I think one of the key issues is the education. Education of doctors working in less happy, let's put it this way, environment than in our hospital where we have everything. We have also more than everything because we are used to repeat tests several times. It's totally not useful. But I mean, to train them to think about and to use the brain, which is still the most powerful weapon we have, and by doing with us things. And this is exactly the aim of the ESA school, rather than to give lectures, which is usually unusual, unsuccessfully delivered, to actually use the hands and the brain to do something. And I think we need to invest a lot of time and a lot of efforts and a lot of money in doing so. And I think we need to go this way. Is anyone willing to interact with Francesco?
I have a question, not a question, maybe a comment and your vision about the, let's say, the networking and also the collaborations between the clinical aspects and also the basic research in the hepatology field. What is your comment? Do you think that in this moment is sufficient enough? Or what can you expect in the future? Because we know that both of the sides of the coin, we need to work each other. For information, I'm not a clinician, I'm a biologist. That's my questions. Thank you.
As I said, I'm insisting on this aspect, which is the collective intelligence factor. I think we don't talk enough. But I think the interaction is a mandatory, not only mandatory, but I mean, you must realize the importance of this added value of interactions, which is not, again, I'm insisting on this aspect, is not just the sum of each individual contribution. The interaction, talking, discussing, when you can think about, you can ponder over, when you come back to discuss with the same people, I had something that came to my mind. There is another value which is actually completely undervalued, if I can say so, by the average investigator. And it's a matter of, I've been working with a lot of scientists who are extremely open. They didn't care about sharing. They wanted to share. They were not jealous about what they knew. They had an idea in mind, and sharing immediately. I was with Avidan Neumann, was a mathematician. He was just sharing many things that Avidan Neumann did. He never published them. Can you believe it? I mean, because you're actually sharing everything. Other people were coming first. So we actually took a huge advantage of these interactions. I'm extremely grateful for these people. I met wonderful scientists in my life. And the best people I remember are those who actually were ready to share everything they knew about you. Not those who were jealous of their knowledge and they did not, they were hiding. I mean, to share is always payback. Let me put it that way.
Okay, thank you.
So I mean, the question is whether we should we interact enough? No, I don't think so. No, we don't interact.
Well, there's one additional, if I may interact. There's one additional issue which actually is bothering me very much, is that it's not only the way you can share with others ideas, but also the pressure you have in publishing things. Now you are used not to have a sort of a comprehensive work, but actually to cut the work in different small pieces, because I mean, 10 small papers are much more valuable than one comprehensive and strong paper, because the impact factor is there, the number of publications is there. And this is crazy, because I mean, I think that we are really under a lot of pressure to do something which is acknowledged. And then there is the race for journals to offer reviews, and then you have to pay for it. Open access is very important, but open access should be aimed to make all the information available to anyone, rather to have
I mean, Claudio, I'm a Wikipedia generation, so for me, knowledge must be shared. Exactly. I don't understand these barriers to knowledge. I don't think.
Exactly. That's very important. Okay. Any other?
I have a general statement, if it's all right.
Hi, Terry. Go ahead.
It was a nice talk, Francisco. I really enjoyed it. Thank you. What's your thoughts on, I was just thinking a lot, many different directions during your talk. You really stimulated my neurons in that area. What's your thoughts? Do you think that in the future that hepatology is going to have more personalized medicine, to where we're maybe multi-therapy treatments that are specialized, or just do you have a minute to maybe elaborate on that?
Yes, absolutely. I mean, actually, personalized medicine was the topic of the other article I mentioned very briefly, which was written by Scott Friedman in 2015, in fact. And he insisted a lot on this, which I understand is true, but to do a proper personalized medicine is not, I'm not against, okay? But to do it properly, you need huge databases. And it's not easy. There are more and more restrictions in sharing data, which I don't really understand, honestly. I mean, that's what we want, privacy issues. And to do personalized medicine, you use monstrous databases, global, worldwide databases. And it's not going to be very easy. I mean, it's going to be extremely difficult, more and more difficult, because of political issues, ideological issues also. But I fully agree. I mean, personalized medicine is the future, of course. You want to just to target exactly. But it's a very famous tenet. I mean, I think it's a Jewish joke in it, but about the mother-in-law knows what is the best match for the child, right? I mean, I think it's a Jewish joke, right? Yiddish joke. She knows how to identify the match for the son or for the nephew, and to do so, I mean, you need to have a huge panel of choices, right? To match exactly. That's why I'm insisting the database is all. Data is everything. Who owns, by the way, very well, who owns the data today? Owns oil, right? Or gold. And if the more and more restriction we put into sharing databases, the more difficult we become at doing personalized medicine. Of course, people know that, and of course, that's why probably they put restrictions, because this means money, right?
Yeah, thank you. That was brilliant.
Any other question?
Thank you very much for your nice presentation.
Andrea.
Hi. I was interested in knowing what you think about, well, you were speaking about the interest of pathology for young generations. What do you think about giving support to interventional hepatology in terms of biopsies, in terms of investigations, in terms of other not only diagnostic but also therapeutic interventions that may bring back, if you want, hepatology to the hepatologist and not give away to the oncologist, as you were mentioning before.
You are afraid of a competition, Andrea. I know that.
I am.
Everybody is. Yes, I agree, of course, but I mean, I have an upper layer, I think. Can I say? Because I'm always a bit, as you know, a contrarian. If you want that hepatology persists in the future, we need good hepatologists. We need role models. The topic is fascinating. I love hepatology. It's always been fascinating for me, even when I was a medical student. I don't know why, but I mean, it's something in my subconscious probably. But if we want that the hepatology survives, we need good hepatologists. We need role models. That's all. And always something I always tell my students, you know, when I come to become counselors to studies here in Geneva, and they come to me and say, I would like to do neuroscience. I would like to do dermatology. I would like to do, and I tell them, wait a second, hold a second. You don't go for a topic.
I see your point.
You choose a person. Because if you choose a topic and you fall with the wrong person, you will hate research for the rest of your life. But if you choose the right person, it will make you fall in love even with dermatology. Sorry about the joke. You know what I mean, right? I mean, so if you want the hepatologists to survive, you need good hepatologists. And the students will follow you. Like the bees follow the, like the bears follow the honey. Believe me.
Well, that's a good point. Any other question? Comment? Well, if not, Francesco, thank you again. I still believe you have to write up your ideas because it's a wonderful piece of thinking, and it keeps your brain in motion. And I think that at this time it's very important, regardless whether you are an hepatologist or a dermatologist or whatever. Thank you very much, and we'll get in touch. Thank you all of you who attended this beautiful seminar, and take care. Bye-bye.
Thank you, Claudio, for the invitation. Thank you all for the discussion and being here.
Ciao.